So welcome. This is a webinar that's pan-London, and it's what this title here says. It's about enabling GP practice appointments that's online bookable through the NHS app. My name's Shankar. I'm a GP lead in the NHS England London team. I've also got Hannah, who's here, who's our senior project manager, and she'll probably help with the chat as well. So why are we here? What are we doing today in this webinar? Well, if we look at the NHS app, it's been projected as the front door to our NHS, but also not really more than the front door, a digital companion to everything that a patient experiences. You might have seen that the NHS app has been refreshed, and this is how it looks now in the new home screen. And appointment booking is right there in that first tab, that first page. And when you look at the patient's flow, there's obviously the book an appointment experience. So when they click on the book an appointment, they get this. They see two options. Ask about a health problem, which usually navigates to our online consultation platforms, or check for available GP appointments. Now, I'm going to put this dilemma to us. I think a lot of our practices, a lot of us are really anxious about putting online bookable appointments here because it doesn't really fit with this flow here, does it? Some of us are trying to do total triage. So we think, will the patient book the wrong appointment if we just put it through here? Or do they book an appointment that's not for their need? So could it cause wasted appointments? These are some of our dilemmas and this confusion between these two different flows about, do we push our patients to go for an online consultation experience where they complete a form and then we help them navigate the booking, or do we allow them? So this session is to really explore practices that are allowing for appointments to be available online to be booked. Now, this whole webinar has been recorded. There's a QR code, there's a link that I showed on the front slide. We'll share that afterwards. And here, this walkthrough video, if you want to see it, this is the QR code and the URL for that. So this is our agenda, and I need you all to really help me with this. I really do. We're going to have 5 practices quickly blast us through their experiences of doing online booking, and we've got 1 practice to represent every single region of London. So great team effort here. Please be gentle with them. They've not had much time to prepare. We want to keep it authentic, and we've got to maximize our time. They've only got 10 minutes. So if you do have questions, please post them in the chat. We'll see if we can pick them up during the discussions. We're going to keep it fast and frantic. And if you're one of the 5 practices speaking, it's going to be like a relay race. We'll hand over from one to another to keep the timings fast. And if we get a chance at the end, if there's any themes and we can do some closing questions, we will. Right, so if I could hand over to Villa Street. So I think we've got Tilly. Are you ready to show us what you're doing?
Hi, yes, I am. But I think that Mohammed wanted to go first because he's just had a baby. So if he's online,
he did ask me about it. So Mohammed,
that's right, Tilly.
Okay,
It's actually fine. Baby's asleep, so thank you.
Okay, we always need to do a group London-wide congratulations, Mohammed, but post that in the chat. So Tilly, over to you.
So this is Villa Street's surgery appointment model. It's a model that we've developed over the last 14 years, basically. Our principles and objectives are that we encourage patients to plan their routine and non-urgent healthcare in advance, providing continuity of care and a choice of appointment options to suit the patient's needs. So for non-urgent and follow-up appointments, we add them onto the system 6 weeks in advance. We add them onto the system in advance, and all of them are available online to book. So for more urgent acute issues, we provide next working day appointments across our clinical team, again enabling patients to book with their preferred clinician. Patients with acute health issues can access next working day appointments, as 50% of them are released every day for all the appointments that are on the system, and they're available online to book. For GP-led same-day triage, we hold back 20% of our appointments for the GP to book into, and they are not available to book online. We add GP and nurse clinical sessions 6 weeks ahead. And that allows people to book their routine and follow-up care and plan it in with their lives and their lifestyles. And it also, all of those appointments are available online to book via the NHS app. Just moving on. So the staggered release of appointments. So this is more the detail here. So advanced online booking, because we add all our sessions 6 weeks ahead, 30% of all GP appointments are available to book online from 3 to 6 weeks ahead. And that is basically allows for continuity and routine care and follow-ups. Short-term booking, so the next 2 available working days are released at 8 in the morning, and they are available. That's 50% of all the GP appointments that are online. That are on the system, and they're released 1 to 2 days ahead. And then if a patient feels that they have a clinically urgent issue that they need to be seen on the same day, then they would call us, and they would be put on our triage list, and they would then be called back by the triage GP, who would then advise on next steps. And that may well be to ask them to come in and see a GP on the day, or it may well be to advise them something different. So we hold 20% of our appointments on the system that are not online bookable, but can only be booked by the same day GP triage. In terms of booking for nurse appointments, again, we add those 6 weeks ahead. At the same time, we add the GP sessions. We ensure that they are for the nurse appointments, because all our nurse team have different skills and different can provide different care and specialisms. We don't make all of those online bookable, but we make things like smears, so cervical screening appointments available online to book, and we have numerous ones of those available every day. And we have things like childhood IMS available to book. But the rest of the nurses we don't make online, except for I'm just not going to go into that detail. So the batch text, obviously they're available to book online via the batch text rather than via the NHS app. So sorry, that was a bit confusing at the start. Hope that was it was a very quick run through of what we do. Welcome to ask any questions.
So Tilly, that's really, really helpful. We've got one question in the chat, particularly saying, Laura's asked, do you triage any of the routine appointments? And no. I guess I'd add, the answer is no. And would it be helpful just to clarify what kind of routine appointments you make available? Like you mentioned nurse ones. Are there any other ones that?
So no nurse appointments are available online unless they're specific, such as for a smear or that sort of thing. For all GPs, there are all the ones that are made available online that aren't held for the same day triage GP. All of them are bookable online from the time that they are released. So 30% of them are made available to book as soon as we put them on 6 weeks ahead. So there's always book GP appointments available to book 3 to 6 weeks ahead. And then every day we release 50% of our session is released for the next 2 working days. So they are also released to book 2 working days ahead online, or via the phone, or whatever other system they want to use to get through to us.
And have there been things you've tried that haven't gone well? Like you've either made certain types of appointments bookable and then actually found some issues and you stopped doing it? And actually sort of a second follow-up question in the chat is about, did you ever feel like you have other ARS staff roles where you felt like triage would have worked to try and push those points to those patients to different types of appointment with different staff?
So one of the things that we find is that basically pretty much every patient puts in a reason when they book online. And we can see those reasons. So our admin team would review those every day to see that what the reasons that have been put in do make sense and are appropriate for a GP. So for instance, it might be sometimes someone puts a reason in saying that they want to book a blood test with a GP, and that wouldn't be appropriate. So we would then contact that patient and say, we've noticed that you've booked for a blood test, can we ask a bit more about that, and then reschedule as appropriate. We wouldn't put in on things like blood tests online, because people then start booking them in because they fancy one rather than they've been requested to have one. So anything, so there's the nurse we used to do pre-COVID. We used to put a lot of different options for nurses online, but it became so complex that it actually just wasn't worth it.
Okay, and there's sort of questions on the chat. Really the same theme of that I've sort of mentioned the fear at the beginning about do you find patients are booking the wrong appointment or inappropriate appointments? I mean, you already mentioned about blood tests as one thing that you decided not to do, but there are other things that you found.
Nothing that really stands out. No, there's not been. There's the odd thing that you think, oh, that looks a bit odd, but we just ring them and check them if that's the reason.
Okay.
I think one of the things is that one of the issues about the online option is it absolutely gives patients choice, but we're also trying to promote online continuity of care. And so if patients are just going, well, I'll have any old doctor, that then doesn't necessarily work with continuity of care. So the balance of that is sometimes put out because of the online option. However, we manage it fairly closely, and we encourage patients to book with doctors that they know and have seen before, and we, particularly with patients that we think it really matters, we would be very clear about what doctors they should be booking with.
Okay, we're in the final minute before I hand over to Mo, so there's some questions in the chat that maybe you can pick up afterwards, but just one theme I'm seeing is still about, like, for example, the cervical screen test you mentioned. Someone's asked about, how do you get that people booking at the right time? Has that caused problems where it's been then wasted appointments or wasted tests?
I mean, there's been the odd one, but in the grand scheme of things, no, because people aren't like rushing to have a cervical smear test when without having received the letter. No one's like desperate to have one.
And are they booking it at the right point of their cycle and things like that?
Like we rarely have any issues with that.
Okay, and there's still questions about they're probably just asking you for confirmation. So you're saying that you don't triage any GP appointments and they book directly, and that's working okay?
Yeah, so we haven't gone down the total triage route.
Okay, and some just questions about your practice. How would you describe the demographics and the general list size of your practice?
Central London, well, I say Central London, Zone 1, a very diverse demographic, a fairly deprived area, lots of different languages.
Okay, Tilly, I want to thank you so much. I'm going to ask us now to hand over to Mohammed, but if you can look at the questions in chat, that'd be great. Mohammed, are you ready to go? Yeah, round of applause for Tilly. Let's hand over to the baton to Mohammed. Now, Mo, don't drop the baton. And don't drop the baby as well, by the way, Mo.
Thank you. So I've received very strict instructions that I must stay within sort of 5 minutes presenting and 5-minute questions. So this is going to be a quick whistle-stop tour of our use of the NHS app. I'm a GP partner at Willesden Green Surgery, which is a Zone 2 inner London, very deprived area. We've been using the NHS app for direct patient appointment bookings for 5 years now, and for us it's amazing both in terms of patient experience and for us, to be honest, for the practice. I'm going to talk you through that. Oh, my slides aren't moving. Just going to quickly make everyone aware that you probably all know that there's the NHS app dashboard, and if you go into uptake and GP breakdown, there is a column here where you can see which practices are using the NHS app for appointment booking. So we've had 7,000 patients booked in via the NHS app. It's one of the highest in our ICB in Northwest London, but there are practices that have been using it more. So if you're just interested in your PCN or your local area who's using it and what feedback you can get locally, I would recommend going on to the NHS app dashboard. In terms of, I think if you're going to use it, it's really important to understand how it looks from the patient end. As well as from your end. So I'm going to go on to the benefits and limitations of it. But first, I just want to show you what it looks like from your end. We're an EMIS practice. This is how it looks in EMIS. We only have 2 slot types. We only allow appointments to be booked with GPs via the NHS app. And either the two slot types we have are a telephone appointment or a face-to-face. When you see a little computer sign, that means you've enabled it to be bookable via the NHS app. So this is on the end of our duty doctor list. We've got a duty doctor NHS app telephone list, essentially. And then throughout our face-to-face appointments, we have about 3 appointments per session that are directly bookable via the NHS app. Our experience is we serve a large population that doesn't speak English, and they will tend to not use the NHS app as much because it's only available in English. There is a way to get the NHS app in other languages. That's through the web browser. Then the web browser can translate it. But generally, it's our more educated, middle-class, English-speaking population that uses the NHS app, and it's our more deprived populations that call. So the reason we spread out those appointments is because it's a little bit, it can be quite complex. Our deprived populations have complex needs, whereas the ones booking through the NHS app tend to be more easier to deal with. So to make it fair on doctors, we spread them out. We want the NHS app bookings because there are more educated and less complex patients. So we have about 3 face-to-face per session, and then we have the duty doctor that gets all the NHS app telephone appointments. We have an embargo that only allows all of these appointments to be released 8 a.m. the day before. So today's NHS app appointments were released at 8 a.m. yesterday. This is how it looks for the patients. Shankar already touched on this. It's literally there on the homepage. They go appointments, check availability. We use AccuRx Triage, and I would say that if you are a practice that uses AccuRx Triage for your online consultation platform, that's not that different to the NHS app direct patient appointment bookings, except the NHS app appointment bookings are much easier for the patients. I would say you need to name the slot types appropriately. So we have written here there are only telephone appointments available. We've made the slot type say you're going to get a call before 2 p.m. This is a morning slot. It's not an exact time. Don't attend the practice. Same for our PM. You're going to get a call between 2 and 7 p.m. because when they book the appointments, they get a direct time. But because we've put that in there, they understand, okay, I'm booking 2:20, but they would have picked the between 2 and 7. They expect a call between 2 and 7. Then they have, this is what's really useful. I really like about the NHS app. They often put in, our experience is that the patients that use the NHS app put in really useful things when booking in the appointment. So here they're referring to me. We get this a lot, that I'm really handsome and that I'm causing palpitations, and they want to know if it's my good looks or hypothyroidism that's causing their palpitations. You'd be surprised how often, you wouldn't be surprised, it happens quite a lot. But jokes aside, honestly, it's really useful clinical information that we get via that page, and there's a character limit, which I like. Sometimes with, you get literal essays coming in through online consultations. So I find that really useful. And then they can put in an up-to-date phone number, which is really useful. You do need to be aware, it then tells them again the appointment's at 2:20. So it's really important the slot types you use tell them they're not going to get called at that exact time if you're not going to call them at that exact time. And then they can, of course, cancel the appointments, and patients often do cancel the appointments. That's how it looks from the patient end, and it's really simple. It is really simple to book an appointment for patients. In terms of the benefits for us, is one, it's just amazing for patients, and our experience is that it's being used appropriately by our patients, despite us being in a really deprived area. They're all things that look about right to us. The thing that I really love about this is that if someone is using it inappropriately, and that will inevitably happen, we're not contractually obliged, to keep this switched on, and you can switch it off for individual patients. So you will perhaps get the odd patient that's booking an appointment a day, and you literally just go into EMIS, and it's a click of 2 buttons, and you can switch it off for that patient, and they can no longer book appointments via the NHS app, and they'll have to use an online consultation platform. You can also embargo the appointments and cap them. So we have about 20 telephones a day and about 20 face-to-face. That's more than enough. We always have a few left at the end of the day, and we keep an eye on it and make sure that the numbers are appropriate, and we cap it and we embargo it so they're only released at 8 a.m. the day before. We have a really low DNA rate in our practice, and I think that's because we're getting people to use the NHS app for appointment bookings, and when you do that, you realize it's just as easy to cancel an appointment as it is to make an appointment. We also have a really high pickup rate of electronic prescriptions, which frees up time for reception. Obviously, this frees up time for reception in that they're not having to call to get an appointment. And sometimes patients are reluctant to use online consultations, but they're less reluctant to use this because it's so easy for patients. And we do get really good feedback in terms of our national GP patient survey and our friends and family test from patients that they love this. And this is one of the things they really like about our practice. And yeah, we do find patients use it appropriately. The duty doctor does triage it. So if there's an appointment there that says, sometimes they'll book an appointment saying I just need a routine thyroid blood test. That's fine. We just get our admin to call and book it and tell them we're now, you're not going to get an appointment from the doctor anymore, and that works absolutely fine. That we've had no issues with that. You can use it alongside online consultations. So we're fine with it not having a total triage model. I say one of the limitations is you could argue that access is too good. It's arguably too easy to get an appointment via it, but we find that people really use it appropriately. That's
Thanks,
that's
Mo.
our experience.
So just going to pick up some of the questions in the chat. So first question was about, the reason for appointment. One question is about, do you find patients ignore it, completion? What's your experience about how people complete that?
No, they all fill it in.
All of them. And you mentioned you've got quite a deprived population,
yeah.
language barriers. Do you still find, we'd say all, like most of them, all of them?
No, nearly all. I would I would say like maybe once a week I'll see a patient. Like it's in the like 1 or 2% they're just booking it with no reason.
And what do you find? And what do you find about the quality of what they write?
It's great. That's why I really like it, because it is more educated people that are using the NHS app currently, and I think that's potentially why. And also people want to give their doctor information. It's an opportunity for them, and our problem is often they give us too much information in an online consultation. You get a life story that you have to read through because you don't want to miss any red flags. So I love it.
Okay, and a couple other questions are you a total triage practice?
No. We have online consultation and we encourage it, but we don't force everybody to use total triage, and I don't think that works for our population.
Do you see any difference in the pattern of cancellation trends when they book it directly versus like if they didn't book it online?
Yeah, you won't get I'm very rare to get to where I see the computer sign, which means they booked it by the app, and a DNA. That's very rare, because once you booked it, it shows you how to cancel it. It's so easy. It'd be a bit odd for someone to. Yeah, you definitely get less DNAs. Whereas if someone's booked it by the telephone and they're worried about a 10-minute wait to get through to the line, those are the ones that are more likely to DNA, because they don't want to wait 10 minutes on the phone line to cancel the appointment.
And we've got Laura, one of the great GP leads in NEL, who asked you, do you find it creates a system where educated patients play the system to get enhanced access? Do you see a difference?
So actually, we have really good access via our phone lines because we serve such a deprived population. Our average phone line waits are under 2 minutes, and we do have really good access for those that aren't digitally enabled. But we want to serve both populations, the younger, more educated, and our older patients. So we feel like it allows us to give a great offering for both populations. I don't think anyone's playing the system at all, to be honest, and the usage is appropriate. If we do think like someone's playing the system and using an appointment a day, we just switch them off, and we do. It's just a click of 2 buttons, and that person will then need to call.
Okay, we're about to need to hand over to the next person, but I'm just going to say the final question was like, there's a general theme about how do you promote it to the patients? Is there anything you've done in particular?
Yeah, when you call our phone lines, it says it's easier to book an appointment by the NHS app. Just log in and book an appointment. We also have a digital inclusion lead who sits in our waiting room and gets everyone set up on the NHS app and shows them how to book appointments via it. Also on our website, when it on the page on how to book an appointment, it's explained there that you can book it via the NHS app, and we also push it in our PPG meetings.
Okay, great, Mo. We'll let you back to your little one. So thanks again for making the time. If I can now ask the next speaker to take over the reins as we pass the baton over. Okay, yeah. So we've got Gerald Lee. Well, I'll let you introduce yourselves because you're Gerald Lee to the DTL, and your colleague. I'll let you introduce
Danielle Chapman. Yeah, she's an assistant practice manager at Farley Road Practice. So thanks everyone for allowing me to share our journey, NHS journey. I'll just share my slides. Can you see that?
Yeah.
Yes, we can.
Okay, I'll quickly take you through the PCN and Farley Road's NHS app change journey, and then my colleague Danielle will give you an overview of how the changes have impacted staff and most importantly the patients. So in July 2023, the PCN made a decision to review and standardise where possible EMIS slot types, review call volumes to ensure sufficient capacity, update the practice's websites, and more importantly, for this webinar, review its online digital applications and usage with a view to improving communications and promoting online appointments. This to help reduce that call rush at the 8 a.m. call rush. Deliverables, actions and recommendations were documented in the PCN's demand and capacity improvement plans, which were subsequently agreed in November 2023. I'm giving you these dates so you can see what happens later on when I show you some stats. Shortly after the NHS App's promotional literature was circulated to patients, and also adding this literature to practice waiting areas, the staff will also provide with refresher sessions on how to encourage patients to download and access the NHS app. So I think Dr. Mo just showed you that you can access your information as a PCN or a practice on the NHS app dashboard, and here I can show you the app logins for the Selnash PCN. You see, before our promotion between before November 2023, logins were hovering between 5 and 15k a month. After promotion, they've moved on to 44k in March 2026. Slide 4, this is Farley Roads, the same thing. Up to about November 2023, they were hovering between 2.5 and 8k, and after the promotion, it increased until it's now at 17k each month, and an average increase of about 6% per month. Slide 5, logins, appointments booked. You can see in April 8, 2022, only 27 appointments were booked via the NHS app. By March 2026, that's risen to 1,316 appointments. That's over the PCN, the 4 practices within the PCN. At Farley Road, April 2022, the 19 appointments were booked, and in March 2026, 610 appointments were booked, and with an average increase of 64.8% per month. Slide 6, this highlights the total number of appointments booked by the NHS app. I've taken total appointments from Optum's Apex data. In March 2023, you can see the total NHS app appointments booked were 316. That's increased now to 610 in March 2026. And the percentage, and this represents a total GP appointments booked by the NHS app, is 22.2%. I've only highlighted GP appointments, and Danielle will advise on the reasons why we only book GP appointments. We do understand we've got an awful lot of work to continue to do as a PCN and as a practice, and we'll continue promoting the NHS app to all existing and new patients. Hopefully, I've not bored you to death with our progress with these statistics. And I'll now ask Danielle to give you a quick overview of how the changes have worked operationally from both a practice and a patient's perspective.
Thanks, Gerald. Yeah, we've obviously, the stats have shown we've seen a great increase in the NHS app now. And I think it comes down to a lot of it, we just focus solely on the NHS app now. I think before there was patient access, and you had this app, and we had a triage app that we were using at one time. And I think it was just too much for patients. So now we just solely focus just on the NHS app. It's quite simple to use. Patients find it quite easy to use. Both our reception and admin teams strongly encourage the use of the app. We have a results department in our admin team, and they will call up to find out, results of their blood test or urine sample or whatever. And then we kind of encourage them to kind of engage with patients then and say, have you got the app? Did you know you can, if you've signed up, you can check your results on here, rather than, calling the practice and having to wait in a call queue, that kind of thing. We also have now just taken on and done some training with one of our staff members to become an NHS app ambassador. because that was another thing that we found. There was a lot of sort of errors and things that patients were struggling with. So we had some in-house training. So yeah, we've got a receptionist is now our NHS App ambassador. So we've got the support there for patients. We also promote it more, not just via telephones. We add things on to the end of like our Accurix messages when we're sending out bulk messages. So for like annual review invites or smear invitations, things like that, there's just a little bit that we kind of add on to the end of our messages. We also get our administration team to send out messages to patients, again via email, because you know it's a free, there's not a cost to the practice, for patients, you know, that have been registered for quite a number of years, and kind of go back through there just to promote not only the NHS App but our social media platforms as well. We found that has really helped, and we've seen an increase in figures for that as well. Like the first lady said, sorry, I can't remember her name, we have our appointments available 5 weeks in advance. We only have online available booking for GP appointments too. We found that when we had this with the nurse appointments as well, we were getting a lot of incorrect things being booked in, and then that would obviously then cost our admin or reception team time to go through these, you know, ring the patients and advise that this has been booked inappropriately, and then to be booked in with the correct clinician. We do have a certain number of slot types that we do have for nurse appointments that you can book online. We aren't a total triage practice yet. So I think we have smear appointments that we have made to be available online. Blood test appointments are made available online because we have, you know, phlebotomy.
I don't know if she's frozen. Anyway, we're running out of time. I think Daniel's frozen and maybe her Wi-Fi's gone. But Jared, I just want to ask one of the top questions is, like, you know, from all the themes of all the presentations so far, there's obviously that theme about concern that inappropriate use or, you know, like frustrations. So Daniel, I think you're back. I think you froze for a moment. We've probably run out of time, but if I ask you one question, you know, that concern about, you know, in the practice that this may not work or the wrong patient's going to book it. Did you have that that thought, that feedback from staff, and if so, what do they think about it now?
Yeah, I mean, we did have it. So we kind of had just a general sort of simple nurse slot type that we had booked in, and it was those that were, you know, the things that they booked in for when they put the reason as to why. It was like, a nurse can't deal with that. It needs to be, you know, a GP. So yeah, it was just costing obviously us a lot of time to go through that and rectify it. I mean, it could be, you know, a discussion that we can have. Maybe we can start increasing a few more slot types to add the online booking, but just the way that our clinics are set out and run at the moment, it's kind of more of a default clinic as opposed to a solid clinic.
Okay, great. Well, thank you very much. We're going to pass over to the next speaker. But yeah, if you can hang around, there's a few comments in the chat. It'd be great if you could give some of those thoughts about your experience. Okay. Is the next person ready?
Yeah. Okay. Unfortunately, let me put my camera actually. Unfortunately, I don't have anything prepared for today as such. My colleague was doing this. Unfortunately, she's away today, so I've kind of been programmed to talk. Not programmed. I've been asked to come in and talk a little bit about what we're doing.
Yeah, that's absolutely fine, Jackie. You're a little bit crackly in the sound, and the video is a bit blocky. So just probably need to yeah, go for it.
Okay, so we've put our appointments online. All of our GP appointments go online. 8 o'clock get released on the day at 8 o'clock, and we release routine appointments at 10 for 2 weeks' time. We find this works really well. We don't do total triage, just because we've got quite a high population of older patients who may not be able to use the app, and we don't want to isolate them. We do have posters up. We have quite a lot of posters up actually. We have a whole station dedicated to the NHS app on how people can do that. We have NHS ambassadors. We have 2 at this site who will encourage patients to use the NHS app. We have encountered some problems, and by having the ambassadors, it's really good because they can go straight back to the people that program the app and give them the feedback. So, for example, a big thing that's come up quite recently is patients can't produce a summary, and it's a small detail, but obviously it saves us paper if they could get it on there. So they're discussing that with the people that do the app at the moment. But with regards to the appointments, what we find is really helpful is because obviously by releasing them online, as soon as they're cancelled, they get released straight back online again. We don't tend to have too many problems with what patients are putting in there, and they tend to give quite a good description of what they're booking in for. We can pick that up quite quickly. With regards to people abusing it, yeah, we have some families that one person will book 5, 6 appointments and then call and say, oh, can I give that to my aunt who's registered here, or can I give that to my son, can I change that over? And we encourage them to all use it, so we encourage the families to get everyone individually on there. Obviously proxy access is an option for most people. We do have a problem with the language, and that's one of the things I know someone mentioned on here, which I've not heard, that there is ways of translating it. If someone would like to share that would be great, because obviously I don't know how you can do that. So if we could get that would be really good. Like I said, unfortunately I don't have lots of data that I can share. I'm sure my colleague Mandy had it already. So yeah, that's what we do. We use eConsult, I would say that. We use eConsult a lot. We really big that up. eConsult, because then you don't have to use the app, or you don't have to ring on the phone. And that way you get lots of information all in one go.
Thank you, Jackie. That's really, really helpful. And just want to say thank you so much. You know, literally only on Friday you knew you volunteered to do this. It was always a brave person to come on last minute. So we really want to thank you. I'm just going to take some themes from the chat. It'd be good to see the experience. So some people have asked about a data question. There's a data question about, you know, the problem with if a patient books online 6 weeks in advance, whereas you know, we meant to sort of contractually offer things within 2 weeks, and then worry about how that can impact on data. Now, Jacqueline, you may not have thought about that at all, but I'm just curious whether that's gone past your radar at all, like some of that tension about appointment data.
Sorry, was you saying about 6 weeks? Do you mean when do we release them?
Or not, more like how far in advance do you release appointments? I mean, how far could you book ahead for some of these appointments?
2 weeks, and the reason for the 2 weeks is, one, patients that are booking 2 weeks is long enough to wait for a routine appointment.
Okay.
We tend to find, we used to release them, we've kind of worked our way backwards. We kind of started off, it was 4 weeks, and we went down to 3 weeks. We found that 4 and 3 weeks, people were not arriving because they felt better. So they forgot about the appointment. So we had an awful lot of DNAs. The 2 weeks, we still get the occasional DNAs, and patients, if they don't feel better, may not cancel, and then that appointment gets wasted. But we tend to find that the 2 weeks is just right.
Okay. So in answer to one of the questions in the chat, in some ways you've avoided the issue because you're in a good way. You've only put appointments 2 weeks ahead. So that probably doesn't answer the question, the issue, which we may as a team need to come back to about the appointment data issue. What about using your staff? Like, are you have you seen any themes about, again, like that you don't use your ARS roles because staff and they get booked in with GPs or nurses inappropriately?
So the nursing, we've not really released them online.
Okay.
I've got at an alternative surgery that I used to work at, and we found, similar to what other colleagues were saying, very, not necessarily inappropriate, but people that just want an appointment think I'll get in with the nurse and then I'll be seen by someone, which wasn't really quite appropriate. And we have a lot of diverse nursing here. So we have AMPs, we have obviously the nursing, and we have HCAs. And with our nursing staff, some of them can do some things that others can't. So, for example, one of our nurses does pheno, the other one doesn't. We just found that people were booking in maybe not correctly. That wasn't fair on patients that would turn up and you'd say, oh, actually, that nurse can't do that B12, so we've got to rebook you. So it wasn't appropriate to put the nursing appointments online. It's very hard to have a slot that's named, this is what you can book in for, and it's so long, they're not going to read that.
Yeah, and I think that's one of the things, probably outside the scope of this webinar, but when you look at the functional flow, that's probably one of the biggest bottlenecks, that our appointment profiling in our GPI systems were never designed really for online booking. It doesn't really tell them duration, skills, what appointment can be used for what. So I kind of echo that. Just one of the themes in the chat is just this whole concept about total triage practice, that this, like we said at the beginning, that this feels against that natural flow, that you're not triaging things. Probably one reflection I have is that even if you're a total triage practice, it's possible to release some appointments that you don't tend to triage, like we've heard about the cervical screening example in previous presenters. But Jacqueline, could you just clarify your practice? Are you almost like a total triage practice, or
we're not
We're
we
not at all?
consult a lot,
Yeah.
current a lot, but no, we're not total triage.
Okay.
We're looking into that.
So Jacqueline, thank you ever so much for your time and participating today. And I'm now going to hand over, hopefully, to the final baton person. So she's probably so Ishan, I don't know if you're ready.
Yeah. Hi everyone. My name is Hassan. I'm a GP in West Hampstead Medical Centre, which is in northwest London, part of Camden. I also work as a digital lead in the ICB or formerly of NCL. And ironically, kind of in my position, it's a bit contradictory that I'm a digital lead, and then we've got we're not doing the total triage model. So and I will share our experience and feedback and welcome any questions. I'm just going to share my screen and I'll try and keep it short. So what is amazing, so just about our kind of appointment model, and the way we work is we've got 24 hours a day, 7 days a week, unlimited e-consult, and we use that for simple and straightforward issues, not for triaging. So we don't triage, and in answer to most people's questions, you really can't triage if you're offering appointments online to book. So basically you can't triage and offer directly bookable appointments. It doesn't work. But what we do use is e-consult for unlimited, kind of simple, straightforward single issues. And we can do that confidently because we have we're a reasonably sized practice where we have a lot of appointment availability, and we encourage and support face-to-face as much as possible. We also support. So where it gets a bit confusing is when you offer an array of different appointments on the NHS app or whatever other similar app. So because once you offer it online, it's not just the NHS app, it's My GP and other apps which are integrated, like patient app of EMIS, which is the system we use. So patient access. So you cannot reliably, when you have a face-to-face and telephone, kind of it didn't work for us in simple terms. What happened is patients often didn't look at the slot type as mentioned, would be confused. So we thought for simplicity, we just do face-to-face online, directly bookable. Then they can be changed upon request if appropriate. Sometimes it's not appropriate, they do change it. And what we say is, for instance, someone might have abdominal pain. We'll say, it sounds like you should come in. They'll say, no, I can manage it over the phone, and say, well, if you need to come in, can you come in? They say they can, and often they don't. So that's one of the kind of disadvantages. But in reality, they would have done a kind of triage anyway, or a telephone consultation with another practice, and then be booked in. So there are kind of advantages, disadvantages, wins and losses. Another thing we do is we kind of manage the administrative burden in a different way. We try to limit the amount that book in online. It's hard because some patients will put things like confidential or say they have a sore throat when in fact they're looking for a doctor's letter. So that's the kind of, you could say, the funnel. The funnel comes from the telephone. So they're released, all appointments are released 3 times a day when we have the overflow of a duty doctor that mops up anything kind of more urgent on the day. But they're fortunately not super utilized, because generally when you're releasing 8 p.m. the night before online and 8:30 a.m. on the day and 2 p.m. on the day, you tend to mop up most requests. The 8 p.m. is a kind of big advantage for having online access, because obviously we're closed at 8 p.m, but that's when appointments are released. So that really encourages people to have an app. However, we have to safeguard for those who are not digitally savvy appointments, so we don't release all of them. And then we mentioned the e-consult. Then obviously someone can come in person and book if they don't have a telephone, or or they decide to come in. And we've mentioned the NHS app, and there's on our website. What's the kind of results? The results for us is if you're looking at kind of performance indicators from QOF, LCSs, we achieve one of the highest for hypertension in North Central London with the most improved. Theirs is public health, from health checks to smears. So we do a different campaign here. If I kind of go outside of my thing, and I'll say, we do that with the self-booking links. So, this is where we'll be sending, your due a smear, and then directly to the appropriate appointments, because as mentioned by my colleagues earlier, you can't reliably allow patients to book into kind of appointments outside of GPs, because often it'll be inappropriate, someone booking in for a smear that they're not due. And so to kind of mitigate that, we invite them for health checks as well. So that's one kind of thing that most practices will do. But one of the best things is about the feedback. And if you're looking, we've always thought that our feedback hasn't been great at 85%. We've wanted it to be 95, 90, but we've realized more recently that that's not realistic. So when we're looking, even in the press, when we were at a lower level, we were the kind of 10th in North Central London. Now we're high level, maybe better, maybe not. Google reviews reflect that as well. And also our list size, which has grown from about 11,800 to 23,000 since 2016. We going back to the presentation, so we're talking about good performance indicators, the highest amount of LD checks, the best outcomes locally with hypertension, one of the highest smears. If you're looking at medicines management, you can see online we have one of the best kind of prescribing nationally, because what it is you're safe. When you're doing total triage and not seeing the patient. So if you do the total triage and you're seeing all the patients, there's in essence a doubling up. And then you have to kind of duplication and repeat your story and so forth. But when you're seeing most of the patients, you can prescribe more confidently, more safely. And then we talked about the good satisfaction, good retention. Prior to COVID, we were one of the highest online access, and primarily because we tried to encourage patients to have access to their records, to see their results, to see the comments of the doctors, but also to book appointments. And that was a good way to get patients to get online access. And we have the second highest nationally when it comes to online bookable appointments. And as mentioned about prescribing indicators, and one of the lowest locally A&E admissions. And when I say lowest, it's not about stats, but it's about safety. And I think that is the key message for us. See patients, you save patients, you appropriately refer the patients that need to be referred. The only problem through the years is often having good access means that we might be seeing more acute patients because A&E times are really severe. So it's not uncommon that we see fractures because they don't want to wait in A&E. And, that would be probably through a triage system mopped up and kind of filtered out. And even for issues like mental health issues, we strongly encourage face-to-face. You can really pick up on things when you see someone in person and understand them better and do more kind of opportunistic interventions. That helps with things like doing physical examinations and checks like blood pressure, weight. We mentioned about some of these, and continuity choice. A patient chooses their doctor and a patient chooses the appropriate time. And I think this is where it is reflected in when we look at kind of the patient survey, and when they kind of had the choice of appointments. I think that's really bad, 79%, but it's compared to the kind of local ICB, it's much higher. And I think, again, 83, we're not happy with that, but relatively speaking, it's supposedly quite a good level. So the risks, the disadvantages often, they come in with multiple issues in a single problem. So that does take longer. And it's one of the reasons is because often they're coming in person, so they may be a bit more late or have higher expectations. They've made more effort than having a phone call. To be honest with you, with phone call DNA rates, I found they're often similar, if not higher, than face-to-face as well. So I thought it would be the opposite, but it hasn't been when I've kind of looked back at data. And I think that's another problem. Is often easy come, easy go if you book online. So if you can cancel it 20 minutes before. So sometimes the DNA rates are, our DNA rates compared to kind of others who nationally are quite good, and they're less. But sometimes it's not reflected because they're releasing the appointments back in, and then maybe or maybe not they're utilized. So that's a kind of something you need to factor. And what I find more often than not is half-day consults are kind of unnecessary, and maybe patients over time realize that and then start booking in to be seen because they start to complain, I've got chest pain, breathing issues, this, that, the other, sore throat, abdominal pain. We say you need to see us, just book in to see us. And over time, patients do. There is something about scale. And we struggled, and we were, I remember back in the day when I first joined in 2016, and we were 11,800 patients, and I was probably earning less than our nurse. So we had to grow to continue the model. And yes, we scaled up in terms of doctors, but we didn't have to maybe get double the doctors, even though the list size doubled. So there are savings with economies of scale, and why this model might not work if you don't have a critical kind of mass of patients. And one of the reasons, and one of the things you have to consider, is the fact that there may be some who take advantage of this. You can limit the number of appointments they book in advance. You can say, we restrict it to 2, for instance, or 3, or 4. You can set that. So, but that doesn't stop them booking every day or every few days. So that's something you need to factor in. But as mentioned previously by others, you can switch off the online bookable appointments element of the NHS app. The rest of it you can leave on for those patients, and then kind of when there's a period of time of rehabilitation, then maybe reconsider that. And the other thing that it's not suitable for is longer appointments, because they're fixed slots. So, where you need a longer appointment time, those patients, we tend to switch their appointments off and say, call in or come in, and then we can try and book in an interpreter and give you the appropriate appointment length. What would be amazing, I think Shankar and others have touched on this, is having more of a kind of alert system for what is appropriate and what isn't appropriate with the slot type. And that we've asked from the NHS App people. They've put in kind of a disclaimer, an optional one, when they book in, but you have to actually open it up. We would like to make that mandatory, so patients know what they're booking in, because they're not going to read the whole slot type. This is just showing you a little bit of an admin workflow for the kind of how we deal with non-clinical matters. We've got our website, we've got eConsult. We utilize both of them. We've got kind of, if they call in and want to book in or to speak to someone regarding their referral or regarding kind of results, how we manage general queries, fit notes. For us, fit notes is an appointment, to be honest, because it's part of their management. It's very rare with kind of more chronic long-term issues that it might not be required. So I've tried to share.
Yeah, so thank you, Eshan. So thank you, Eshan. That was really great. I mean, maybe you can help join us in this sort of final closed question time. So we've got about 3 minutes left. I think first of all, and maybe this is an open discussion. I mean, definitely the theme in the discussion is around how do you see this? How do we see this with total triage practices? And one reflection I have about looking at all of our presentations today is that basically different practices are experiencing different things, aren't they? Like we had Mo saying, cervical screening, like we had Tilly sort of talking about cervical screening, no problems, people booking into the right appointments. And then I think, Eshan, you've mentioned that you found the opposite, that was causing problems or incorrect. Is that correct?
Yeah, so basically, you have, and this is unfortunate, but there's a lack of integration that's happening in the system. So I personally have to go into the cervical screening management tool and then download the database, because EMIS doesn't have the accurate database either. So you exclude from both. And this is where at least I can be confident with the cervical screening database that when my nurses send off for their smear, that it will be accepted, because often with EMIS it won't be integrated or updated. What would be great is if, for instance, the NHS app had that functionality embedded within it to say to them, yes, you're due, no, you're not, and then it checks that system, cross-references when they're due, and then if they see that they are due, then it allows them to book in. Similarly, there may be other kind of with regards to other conditions or situations where there may be an element of AI through the NHS app, which might do some initial filtration. But at the very simple thing is, with the doctors are the only ones which bar for smears and wound care, which sometimes we get in. So somebody might book an appointment with a doctor for a smear. It happens from time to time, and you need to kind of have someone overlooking the appointments, or sometimes it does slip through the net. The opposite also happens with nurses, as mentioned. If you have the nurses available online, sometimes they'll think they could do things outside of their scope. They don't know. So you have to have an alert for me in the NHS app, which has to be customized by the practice, outlining for each clinician what is within their scope and not within their scope.
Yeah.
And that would allow us to give more confidence to open up for other appointments.
Okay, so I'm going to now wrap us up, just because we've run out of time. So I think the last point is a point. I think first off, I think all the examples, we're not saying things are perfect. Clearly, like the whole appointment profile, it's not really even about the NHS app. It's about how do we profile appointments in our GPI system. It's not just about types, it's the pre-appointment instructions. So clearly there's a developmental process. And if that profiling changed and made it more designed for online bookable, probably all of this discussion of some of the issues would diminish. I think the second point is I'm seeing across all these presentations that practices have different experiences, but they're also seeing some good out of it. They're seeing benefits in different ways, whether we saw talking about patient feedback being really high or list growth. And then when I'm thinking about total triage practice, I think, could we worry that that's not sustainable in the future? Like if you had to triage every single appointment, is that a huge admin workload? Are there some certain appointment types that might be worth that risk? So still, yes, the patients will book the wrong one, but maybe it gives that choice. And I think there's another theme in the question about, are we creating unfair advantages? There's a question about, I think your example of booking a telephone appointment directed, if that's a triage telephone, do they trump, if they filled in an online consultation form? I mean, I guess the way that's seen is that we face that dilemma already about different modalities, whether a digitally excluded patient. But I think nowadays when we look at I dread to say the new GP contract, but when you look at it, you're tending to triage quite fast. So usually if someone's booking a telephone appointment, maybe they're actually not advantaged, they're disadvantaged. That appointment may be further into the future. Anyway, so lots of thoughts from today to consider. And I guess that is the point of today. It is to say we may have some fixed thoughts of how we think it's going to work, but perhaps some gentle piloting in practice of looking at it and learning from it could be really helpful. And I just want to end by saying a big thank you to all our speakers today for presenting their experiences, and an even bigger thank you to all of you for attending this webinar when we know how busy you are in primary care, and making time is really hard. So just on behalf of the London team, Hannah, myself and Shona, who also helped organise it but is not here today, all our speakers, thank you so much for attending, and we want to wish you the best for the rest of your afternoon. We'll make sure recording of this presentation is shared quickly with the slides as well. So thank you so much for your time today.